the vision seminars, the church acrostic, how to get involved. You have life experience where you saw this happen over almost a decade, plus or minus. What was your experience once the vision seminars started happening and the churches began to engage and say, yes, I'm in, we're doing it? Tell us that story.
Well, all started with very, I should say, easy things that the church started doing, and that I should say ordinary things that were done by ordinary church members that operated extraordinary changes at the hospital level. And just talking about patients' nutrition.
Mm-hmm.
As we said in the previous module, that some of these patients we were taking care of would walk for 2 days, some for 3 days to reach the hospital.
Wow.
Where they are admitted for weeks.
Mm-hmm.
So, which means having food once they are admitted was a huge issue.
And the hospital didn't provide food.
And the hospital didn't provide food.
Gotcha.
So after the vision seminars, we saw church volunteers coming to visit patients with what they started, and that was called the church-initiated feeding program.
Okay.
Where church volunteers mobilized by the leadership of the church that received the vision seminar, coming to feed the patients, and that had a positive impact on the response to treatment in many of our patients, and that is a very remarkable change that was quickly observed.
Let me even play semantics with you, because I believe the church-initiated feeding program, the hospital didn't ask for it. The church came to the hospital and said, we noticed that patients are coming to you. They might even have food, but no one to cook it for them.
That's correct.
And we can cook. We have, many of us want to help folks. We will come by, and I think they had like a schedule. They would roll through, and the hospital picked the half a dozen patients or so that were the very sick, couldn't get out of bed because they were so sick, even if they could cook. And they took over. They adopted those patients and fed them. It was very rewarding for the people I spoke to who came to cook, but also for the patients. There was so much thanks, and there was so much evangelizing through action that took place. And it was completely church-initiated.
Exactly.
So beyond that, so feeding program, anybody can cook. And the opportunity to engage at the hospital level, at that level, is just fun and enjoyable. And patients were no longer starving, which is just an amazing win. I can't believe that for some of us where the hospitals do feed patients, that was a surprise to us when we came to Rwanda. But the church took care of it, and it was fantastic. Beyond that, keep going. I interrupted.
Yeah, well, and when you look at the benefits or the impact of just the church-initiated feeding program at the hospital level, but also at the church level itself, in terms of church growth, we're talking about a patient who's admitted and who's now being fed or helped to have his food cooked, and know that this was done by the church. So yes, it helps us as healthcare providers, see our treatment, doing well in our patients because they are also fed. But at the same time, the impact of the help on the patient himself. And there are stories of patients who didn't know about Jesus Christ and who definitely decided to start attending a church because they were preached by the model. Being fed by church volunteers, and so that was the entry of Jesus in their life.
What a story!
And went back to their communities, became effective church members.
I even remember some of those members became, they actually became active members of they brought the Vision seminars, like that was part of the expansion.
Exactly.
Amazing.
Exactly. So the other remarkable change was with the stigma removal. So talking about the example of HIV/AIDS, for example, we are in a context or in a part of the world where at some point people believe that when you get infected with HIV/AIDS, you are likely to have committed a sin, and that's how you got infected, and therefore you are not in harmony with God, so you're not a good member of the church, and kind of
Stigma.
yeah, so you're stigmatized, and no one would want to go for tests, because if you go for tests, then the surrounding community would see you as someone who's suspecting yourself, and you want to know how you are. Probably you misbehaved, and you want to get tested. So all of those are factors that contributed to increasing the stigma around HIV testing. So, but after the Vision seminars, I should have said that during the 4 hours workshop, which is the Vision Seminar itself,
It's a workshop.
so people learn about the basic, how one gets infected with HIV/AIDS, different ways, and quickly discover that it's not only by committing a sin that you can get infected, right? So people learn, and the church volunteers and church members learn about a way one can get infected with HIV/AIDS. And one of the things they go or they start doing in the church is to talk about HIV/AIDS and discuss the benefits of being tested. And at the hospital level, we started seeing, more people, among them church members, coming actively for voluntary counseling and testing. We saw more people who were living with HIV/AIDS without knowing that they were infected, discovering their status and being started on the medication. So we saw a significant increase in the number of people not only, being tested for HIV/AIDS, not only in the church community, but also in the general community as well. And I don't have numbers in mind, but that contributed to the national rates of acceptance of HIV/AIDS counseling and treatment.
A palpable change. It's interesting you bring up about stigma, and stigma is everywhere. I think all of us, there may be different versions of the same story, but we talk about giants when we talk about the peace plan and going after those giants. And HIV/AIDS was an initiative we started with, and that was we were asked to go to Kibuye, and because of the HIV rates and the stigma and the need to test. So that as we talk about HIV/AIDS, that was kind of our first step.
Right.
But the fastest way to keep a giant alive is to not talk about it. And it was rampant. It was pandemic, epidemic, HIV. Imagine going to a church where they say, we love you and we want you to be tested. It's such a dramatic change. And I think all of us can take lessons from that, that there are opportunities where someone's feeling left out because of a certain condition, mental health, you name it. There are many conditions where people want to pull away. It's like, no, the church is here for you to be involved and be loved and participate. In fact, many of the members who became the most active were those that were living with HIV/AIDS.
Exactly.
So it was fantastic to see. I had the pleasure of going to Rwanda, I believe it was 6 times over that period of time. And you lived day to day and saw the change. I would come in once or twice a year, and the stepwise improvement was profound. And the attitude and the behavior and I'll say joy that came out of seeing the effect of this basic needs. Way back at the beginning, just to touch on it, you talked about the simple things, the ordinary things, like cooking in the feeding program.
Yeah.
What were some other things that the church members were doing at this time that were the anybody could do kind of things? What else might there have been?
Well, the other thing, and which this was one of the challenges we were facing as practitioners, and I mentioned the compliance to treatment.
Taking the medications, right?
Exactly, and after the vision seminar, and of course after a certain very basic training that church volunteers received, at least those who didn't have any basic knowledge on healthcare, but the church started to initiate support groups.
Okay, tell me about that.
Support groups of patients living with HIV/AIDS, and that later on expanded to support groups of patients living with other conditions like diabetes and hypertension, and that helped a lot to promote the healthy behavior among those living with HIV/AIDS in terms of positive prevention, in terms of adherence or compliance to their treatment, and a remarkable impact on their biological markers. And I'm talking here about the viral load and the CD count, or technical words, you can ignore those, but those are biological markers that are used to monitor a patient on HIV treatment, to talk about HIV here. So church initiated patient support groups, and in these groups the pastor would meet them on a regular basis. And other, equipped church volunteers would meet with them, and among those equipped church volunteers, members living with HIV/AIDS themselves, supporting each other, reminding each other the positive way to live with HIV/AIDS and maximize the outcome on treatment. But at the same time, we saw church-initiated health talks. These are talks conducted this time not at the church level, but at the clinical level,
Okay.
with church volunteers living with HIV/AIDS and others not living with HIV/AIDS coming to support the hospital and the health center staffs.
Wow.
To teach others, other patients about HIV/AIDS prevention, care and treatment. And a 1-hour health talks 2 times a week in the morning, and that helped a lot to see the positive changes that were observed as far as these patients' adherence into the program and positive prevention is concerned.
You bring it up again and again that community, just communicating, breaking down the barriers, the opportunity for church members either living with, say, HIV/AIDS or really any condition. You mentioned diabetes. I remember there being a few others. The opportunity to know you're not alone with this. There's great evidence that, and God didn't want us to do this alone. We're supposed to be living together, working in community, growing as a family. And I forgot about the training programs actually, where they would come out and give the lectures. Here's someone who has, or actually not all of them did, but many of them had the virus. People they're scared coming into the hospital. They just started on medications. To learn from someone who's done it. They're living with it, and they're empowered with it because they're working through the church. Again, it's just an amazing story. And again, the hospital didn't invite you out. They said, we can do this.
Exactly.
It's an action step. So let me break out for a moment. There's two good examples. I know we have more. How did this grow? How did we go from, you mentioned before in some of our other talks about, we started pretty small. It was kind of that one area, that one part of it was even kind of at the subsector level initially. What was your view or your observation of the expansion of care for the sick in using the church model and these vision workshops? Tell us that story too.
Well, maybe before I share that story,
Yeah,
Dr.
keep it away
Bell,
from me.
if
Okay,
you
go
don't
ahead.
mind.
No, go ahead.
I know a lot of people may be wondering how, just from a 4 hours workshop, people would start doing all of these things, the church volunteers. Now, it's important to clearly understand that there are some of those church-initiated programs that started right away after the Vision Seminar. But after the Vision Seminar, it's important to understand that there are, and I know that there are other, modules that will be talking about this a bit more in details. But the church volunteers who have self-discovered themselves after the Vision Seminar were committed and decided and developed this passion to care for the sick. And I was personally blessed to participate this time, I should say, as a doctor or a healthcare professional, to equip them with a very basic knowledge. A number of modules or lessons on a number of identified health problems. We've been talking more about HIV/AIDS, but other problems as well, malaria, and I know this can be will be discussed later. But a 24 hours basic training
Total.
So that's 4 hours. I mean, 4 hours for 6 days.
Okay.
So 6 half days training, enough to equip one to do the healthcare education at the clinic level that I was talking about. So they got equipped, started ministering both at the clinical level, at the church, in the church, and at a community level. So what was the question again? Before I forget.
Well, I was talking about the expansion, but you said you were talking about those 24 hours. The vision workshop, it was the first step. But and people might catch. So we say a passion. They want to investigate their shape. We talk about shape a lot.
Right.
How do I get engaged? Let me take you 2 steps then. One would be after that vision seminar. What might have happened first? What was the next step?
Right.
And some people got trained.
Right.
And then after we talk about that, tell us just how did it grow as a model?
Right.
I know we're going to talk about the community in another module about going from 1 house to 7 houses, but just an overall feel at the end. Over your experience, how many churches, how many church members became involved after you?
Yeah, now we have the first sector with a small number of local churches with 1 clinic. In this case, was 1 hospital and 1 clinic with approximately 30 churches surrounding those 2 healthcare facilities.
And these are small churches. They are not 5,000 people.
Exactly, small churches who have received the Vision Seminar, who right away have initiated patient feeding program, and who receive a 6 days training, and who go back in their churches and their communities, start mobilizing people for testing, mobilizing and educating those living with HIV/AIDS, and organizing them in support groups, but also getting organized themselves after the training they received to train others outside the one sector.
Train the trainers, right?
Exactly. So I remember we started with, was it 14 peace servants who, were trained and who went back in their churches, trained more. I don't have the numbers in mind, but within a 4 years period of time, we had up to 3,000
Wow.
peace servants or church volunteers.
Church members, yeah, they're just members of the
Yeah,
church.
trained on basic healthcare, education, and who, expanded the whole church model in 13 sectors within the district
Okay.
in a 4 years period of time. So all started with this small number of trainers who are church volunteers who had received the basic training
Going out.
going out in other sectors.
It's interesting.
And that's how it moved from just 30 churches around these 2 clinics to 720 local churches surrounding the 3 hospitals within the district. And I think approximately 70 health centers around, or a bit less, as satellites to those 3 district hospitals.
There's an interesting piece here about, we talk about the one local church, you talk about 30. One of the things I observed when I was out there, and I think there are many areas in the world where this may be, churches also feel like they need to go alone. Just like those individual members we were talking about, every church feels they have to go it alone. In Rwanda, in our experience, part of these trainings and care for the sick, churches were coming together to affect a community. So one church, and then 30 churches, and then everyone just loves their community. Churches can work together on a lot of this stuff, and I across different Anglican to the Pentecostal to the Baptist, there are fundamental truths that we all share, and outreach and caring is really kind of the key. So from 30 to 720, we talked about the 3,000. Let's wrap up on this and just comment on sort of the education, but how, again, going back to the kind of basic, that this was not hard stuff. This was not led by a physician. This was not led by the hospitals. These were people discovering their passion and really taking a step back and saying, I look at my community in a slightly different way, and I can commit to, I can engage. Do you have any kind of final consensus on how hard was it for us to go from 1 spot to 10 spots to 30 spots to 700 spots? That expansion seems very rapid, but do you think there's any knowledge or lessons that we can share that made it better, made it worthwhile, made it possible to get that big so quickly?
Well, there are many lessons, and one of the things that I learned is the fact that the involvement of everyone from the very beginning contributed hugely to the success that was observed. And when I talk about everyone here, I see the local government understanding that, hey, we have strong and powerful local partners here. And not only NGOs coming with money are strong partners, but we have local churches who can really make a change. So that, I came to learn that was very important and contributed to the success, because everyone understood what's going on and what's going to be done, and why it's important to support that effort, the local church's effort to contribute to the efforts being done to develop healthcare. So the other thing is that the commitment and the passion to serve that was seen already in the leadership of the church, but
Came from top. Mm-hmm.
that came from top, and the church taking the lead.
Mm-hmm.
So we have church volunteers here understanding that it is their responsibility to do what they are doing. And no one else needs to know what's being done as long as the pastor knows that I am serving and God knows that I am serving, I'm okay. So I observe that, and the whole passion and the whole motivation, I think, came from the local leadership, the church leadership, and that helped a lot.
Okay.
And wherever that was not present, things didn't work well.
It's a good point. You know,
Yeah.
we're not perfect. We learned along the way. I know we changed things as we went, but the two key points I pull from that, one is to always be inclusive. We talk about healthcare many times becoming an exclusive portion of missions work, or well, we go to our doctors and nurses. Be inclusive. Everyone can participate here. Get buy-in from everybody. We're doing this. And I like the comment that many of us in the developing world see these powerful NGOs. You know, the power that they have mission. They have they're there to help. Nothing against that. But one of the most powerful partners is actually the local church. You don't have to come from afar. You can be there. And I encourage all the local pastors and local members, wherever you are, you have tremendous power in your community, probably the most, because you know your community. So when we saw that on many occasions. And then having the leadership have buy-in, you know, the purpose-driven model, the idea that we need to participate in our community. We need to become active and engage. So I appreciate this.
Yeah.
This was last thoughts. Go for it.
Yeah. Before I forget, the other thing that from my observation, from my learning, I noticed that contributed a lot on the success of the model was the unity among the local churches. Because we're talking here about the church, not about the Catholic Church or the Protestant Church or the Muslim, but the whole church. And when I talk about the Vision Seminar, there are church volunteers or church members from the Islamic Church, the Catholic Church. So it's everyone. So that unity, seeing Muslim patients who were sick being ministered by people from a different, religious confession. So that also contributed to the success of the model. So it's a joint effort that definitely led to whatever success was observed. And definitely there was a lot of successes.
Good. We're all God's people. We need to learn to play together.
Exactly.
Right. Good. Well, thank you for this one as well. This was very instructional for me.
My pleasure, and thank you too.
Thank you.